Lise.
Well, a University of Missouri professor is back in the classroom 1 year after a health scare that nearly cost him his life.
In this morning's Focus on Your Health, Teresa Snow explains why he owes everything to his former students.
Focus on Your Health is sponsored by MU Healthcare.
Every year, nearly 350,000 people will experience cardiac arrest outside a hospital. The survival rate is less than 12%, but those odds increase if just one person jumps into action. Shutran Zong is most at home in the lab, teaching biochemistry students at the University of Missouri. And it was here last February that his heart literally stopped.
He went over to sit and work on his laptop, and probably like 30 minutes into class, we heard a big thump.
I thought he just slipped and fell, and it was figured I asked him, is he okay? Figuring he would just go, yes, and we'd all kind of have a small laugh at it. I really started getting nervous when I heard nothing.
While Colleen Compass spoke to the 911 operator, her lab partner, Eric Prulidge, started CPR.
I haven't been certified in a long time, but I remember a decent amount of it, and I volunteered.
Zhang was taken to University of Missouri Healthcare. For 2 weeks, he remained in a coma, but thanks to his students, he was alive.
They were very excited when I started to have a response. Initially, it's just like hand movement. If I was asked something, if I have a response, I can squeeze hand.
After further testing, a team of specialists determined the problem, Brugada syndrome.
He just has an abnormality in the electrical circuit of his heart that makes him more prone to having a sudden cardiac arrest.
There are rarely warning signs, and most people don't know there's a problem until the heart stops working. Zhang began to relearn things like how to brush his teeth, how to walk. But there was somewhere else this professor wanted to be.
I really want to come back to be together with my student who saved me.
And just 2 months after his heart stopped, Zong returned to the lab and his students.
That he still knew, what we were doing, what we were trying to accomplish that semester, and was still impressed with our results was very, very heartwarming.
Professor and students now connected by a bond that goes far beyond the classroom. Joining me now is Andrea Kuensting, an advanced practice nurse here at MU Healthcare. What a great story and a great outcome. What is his future like?
Yes, well, now we see him in clinic about twice a year, and he has a monitor at home where we're able to monitor his heart rhythm with his implanted cardioverter defibrillator. We're able to detect arrhythmias early. We're able to monitor the functioning of his device and hopefully help him lead a full life.
Give him some peace of mind, that's for sure.
Yes.
Now, this Brugada syndrome didn't have a lot of warning signs, but for others, there are risk factors that they could deal with first.
Yes, high blood pressure, high cholesterol, blockages in your heart, those can all predispose you to bad heart rhythms. So the treatment of those things and prevention of coronary artery disease are very important, and leading a healthy lifestyle as well.
His students knew what to do and they were in the right place at the right time. How important is CPR training?
CPR is critical. He was so fortunate to have people nearby that knew what to do and could call 911. Another thing that would be very handy is if an automatic external defibrillator was handy, and you'll oftentimes see those nowadays to treat a shockable rhythm.
Can make a life-saving difference.
Yes.
Thank you very much,
You're
Andrea Kuensting. With Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.